Hi, I'm Dr. Glowiak, and I'm a licensed clinical professional counselor specializing in addiction. Let's go over what an addictive personality looks like. In this video, we'll discuss what is an addictive personality traits, how the concept of an addictive personality can be unhelpful, and addictive behaviors in general. First, what is an addictive personality? The terms addictive personality or addictive personality disorder refers to a hypothetical set of personality traits that may increase the likelihood of becoming dependent onto many things, stemming well beyond drugs, alcohol, and other substances of misuse. However, there's no scientific evidence confirming this personality trait. It's an example of addiction myth versus fact. Let's go over addictive personality traits. While it's true that certain science traits increase the likelihood of some people being more prone to addiction than others, addictive personality traits are purported, as there's minimal credible evidence to support their existence. Interestingly, the signs or traits leading lay people to believe they have an addictive personality align with some of those used to clinically diagnose. Therefore, the entire concept, though unsupported, does make sense. Here are a number of supposed signs of an addictive personality: comfort eating, binge eating, using alcohol to socialize or relax, checking one's phone or social media too much, replacing sexual partners for a false sense of intimacy, impulse buying, excessive shopping, gambling, obsessing, excessive risk-taking, drug use for coping, never feeling satisfied or needing more of a particular feeling, an inability to stop using harmful chemicals, and an inability to curtail other harmful activities. So, how can the concept of an addictive personality be unhelpful? Concept of an addictive personality can be unhelpful in many ways. Think of the saying, once an addict, always an addict. For those struggling with an active addiction, this mentality may make it harder to recover as they believe the situation is unchangeable or that their personality is inherently flawed. Though addiction is considered a disease that's treatable but incurable, this does not mean in any way, shape, or form that one cannot change. In fact, numerous people recover and maintain it every year. Such self-defeating logic makes the situation both helpless and hopeless. Rather than focus on specific personality traits, problematic behavioral patterns may prove more indicative as to whether someone has a propensity toward addiction. Problematic behavioral patterns around social drinking, eating, sex, staying plugged in, gaming, impulse shopping, or otherwise are much more telling. Some final thoughts. Although addictive personality disorder isn't a diagnosable condition and addictive personalities don't truly exist according to the research, you know yourself best. If you believe that you're struggling with an addiction of any kind, speak up and seek support. Help is out there. The longer you wait, the more challenging it becomes.